Hey, good morning.
Morning.
My name is Maurice. I'm going to be your nurse today. Okay, the doctor ordered me to do a head and toe assessment on you, okay? So we're going to be checking your, we're going to be looking at your whole body, okay? And we're going to be checking your heart and all that, lungs, make sure everything's fine. Is that fine with you?
That's fine.
Okay, let me wash my hands first. All right, before we get started, can I have your name and date of birth?
Leslie, August 8th, 1997.
Do you have any allergies?
No.
No? Okay. Do you, let me ask you some weird questions. Do you know where you're at?
Hospital.
Hospital, do you know what day of the week it is?
Sunday.
Do you know why you're here?
Wellness check.
Wellness check. Okay, so are you in any pain today?
No.
So how's your mood been today and the last couple of days?
It's been good.
Been good. Perfect, perfect. So we're gonna put some gloves on. Okay, so the tech came in here before me, checked all your vitals. All your vitals are good. Everything was normal. Also check your visual acuity test. So check your cranial nerve 2, your vision. Your vision's normal, it's 20/20, so everything's good, okay?
Okay.
Okay, so I got my gloves on. We're gonna check your hair. Get right to it. Check for bumps, bruises, lesions, hairs evenly distributed. Is there any tenderness?
No.
No, perfect. Okay, let me check your thyroid. Palpate for your thyroid. There's, it's not palpable, that's perfect. Your trachea, make sure it's midline. She swallow for me? Okay, good, good. Okay, can you turn your head to your left? No signs of JVD, the right, and no signs of JVD on the left. Perfect. Okay, so now we're gonna check your nose, okay? Nothing abnormal, no leakage, no inflammation. Can you say ah for me? Pink and moist. Can you put your tongue to your side, your other side? Can you put it out your mouth from side to side? Okay, can you say ah and swallow? Okay, and put a tongue blade in your mouth. Set your gag reflex. Say ah. Okay, perfect. Your cranial nerve 9, 10, and 12 are good, okay? Okay, now we're gonna check your carotid arteries, okay? Check. It's good. Good. I'm gonna compare your carotid artery to your radial pulse. Good, good, perfect. Everything's normal. Let me check for any abnormal sounds, any bruits, any carotid arteries. Nope. Everything's good. Everything's normal. All right, so I'm gonna check for your lymph nodes. Okay. Pre-ocular, posterior ocular, your occipital lymph nodes, retropharyngeal lymph nodes, submandibular, submental, anterior cervical chain, posterior cervical chain, supraclavicular. Okay, so none of your lymph nodes are palpable, so that's normal. Perfect. Okay, so now we're gonna check your ears. No leakage, no redness, no swelling. Everything's normal. No leakage, no redness, no swelling. Perfect. Okay, so I'm gonna check your eyes, okay? So like I said before, they Snellen chest, so check your cranial nerve 2, which was good, normal. Now we're gonna check the other cranial nerves of the eyes, okay? So, pupil equal, round, reactive to light, cranial nerve 3. Okay, so you're gonna follow the pen light. We're gonna do your six cardinal fields of gaze, okay? So don't move your head, just follow the light, okay? Okay, 6 fields of cardinal gaze are intact, as well as accommodation, so that's 3, 4, and 6 is good. All right, so cranial nerves are good. So close your eyes, hold one nostril. Let me need you to smell this. Tell me that smell is.
Mint.
Mint. You know, the other one, smell this one.
Chocolate.
Chocolate, perfect. Cranial nerve 1 is intact. And this is good. Okay, so now we're gonna check. You need to close your eyes. Let me know when I'm touching your face, okay?
Touch, 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 touch.
Okay, perfect, perfect. Can you, I'm gonna hold your TMJ joint. Open and close your mouth. There's no tenderness, no pain. Okay, now can you smile for me? Frown. Open and close your eyes. Okay, now close your eyes and let me open them. Okay, cranial nerve 5 and 7 is intact. Okay, so I'm gonna need you to cover our ear. We're gonna do a whisper test, and I'm gonna whisper something. You're gonna let me know what I do to say, okay?
Car, truck, bike.
Okay.
Mouse, dog, cat.
Perfect. Okay, I'm gonna need you to stand up. Put your arms down to your side. Close your eyes. There's no swing. So this Romberg's test is good. Normal findings. Okay, I'm gonna need you to take a couple steps forward. Okay, now a couple steps back. Gait and balance is normal. You're good to sit down. So gait balance is normal. Romberg's test, your whisper test came back good. So cranial nerve 8 is good. Now can you shrug for me? Now shrug again. One more time. Can you put your ear to your left shoulder? Your right to your right. Okay, perfect. Your cranial nerve 11 is intact and is good. Can you lay down for me?
Mm-hmm.
Okay, so this shin, you're gonna bring it to this knee. You're gonna trace the shin all the way down. Okay. To the knee. Now the other one. Bring it to the knee. Straight line all the way down. Okay. Now your hands. You're gonna smack them back as fast as you can. Okay, your upper and lower motor neurons are intact. They're good. Normal findings. You're good. So yeah, just swing back around. Okay, so now we're going to take off your gown. Is that fine with you?
That's fine.
Okay. So to take off your gown, skin, no bruises, no lesions, no abnormalities. Skin is appropriate. Check for your skin trigger. Recoil is immediately. We're gonna check. So can you squeeze my hands? Squeeze. Okay, now you're gonna lift your arms up. Okay, lift them up. All right, now lift them down. Okay, now can you swing your arms side to side? Okay. Range of movement and strength is appropriate for the arms. We're gonna check the radial pulse. Okay, they're even. Check your brachial pulses. Even. Okay, now we're gonna check your capillary refill. Less than 3 seconds. Perfect. Okay, like I said, thoracic cage is symmetric. Muscle distribution is good. No signs of barrel chest. No signs of barrel chest. Skin. Check your skin. Skin's warm. Skin's warm. Appropriate. Okay, so now we're gonna. I'm gonna check your respiratory expansion. Okay.
Mm-hmm.
So you're gonna take a deep breath in, a big deep breath. Perfect, perfect. I'm behind you. One more time. Okay, normal. Everything is normal. Everything's good. Okay, so now I'm gonna listen to your lungs. Okay, we're gonna start posterior. This will be on the skin under your gown. Okay, so direct skin contact. Breathe in every time I move this. Okay, respiratory was normal. No abnormal findings. You check your right lateral 3 times. Okay, again, check twice over here. Once again, this would be directly on the skin. All right, now every time. breathing was normal. Normal effort. Okay, so now we're gonna check your heart. Okay. Check your aortic valve, right intercostal space, second intercostal space, right external border. Then pulmonic valve, second intercostal space, left external border. Herb's point, third intercostal space, left external border. Tricuspid intercostal space, fourth intercostal tricuspid valve, fourth intercostal space, left external border. Then the mitral valve, fifth intercostal space, left external border. We're gonna stay here a whole minute. Okay, so the heart rate is 85 beats per minute. Like I said, we're gonna stay there a whole minute. Everything's normal. Everything's good. Okay, now you could lay down for me. We're gonna check your abdominal region. Okay, before we start, when was your last bowel movement?
Today.
What color was it?
Brown.
Was it consistency?
Solid.
Was it normal?
Yes.
What about your urine?
Today.
Was it color? Was it
Clear.
Did it smell?
No.
No. Okay. Is it normal?
Yeah.
Perfect. Okay, so we're gonna look at the abdominal region. We're gonna inspect first. Contour is round. There's no lesions, no scars, no distended abdominal, no distended anything in the stomach region. We're gonna auscultate it first, starting the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, so we did hear abdominal gastric, no HM10, so it's normal, normal bowel sounds. So now we're gonna percuss. Let me know if there's any tenderness, starting with the right lower, right upper, left upper, left lower. Okay, now we're gonna lightly palpate. Let me know if you feel anything. No tenderness, no nothing. Okay, now we're gonna listen to the abdominal arteries for any bruits. Nope, no bruits. Everything sounds normal. Okay, now we're gonna check your legs, okay?
Mm-hmm.
So we're gonna pull the legs. Color is good. Patient's warm. No pitting, so no edema present. We're gonna check the posterior tibialis pulses. We're gonna check the pedialis pulses. Okay, now can you lift your legs all the way up for me, one at a time? Next one. Okay, now can you lift it up against my arms? Now bring it down. Now lift it up, bring it down. All right, now we're gonna check your plantar flexion. Now push. Now we're gonna check your dorsiflexion, pull. Okay, check capillary refills. Less than 3 seconds. Perfect. Will you sit up? All right, now we're gonna check your patella reflex. Good. Good. Okay. Let me check your capillary refills. I can't remember if I did. Just make sure. Perfect. All right, so that should be it. All right, thank you for the time. You have a good one.
Okay, thank you.